The central line draw method can be used for collecting blood specimens when patients have central lines and it is difficult to use the other techniques. This is not a preferred method since the chances for contamination are increased significantly. Identify the patient according to facility policy and have all necessary supplies and equipment within reach. The nurse or other licensed personnel must disinfect the central line port with chlorhexidine-based antiseptic and perform the draw. While the nurse prepares the central line for the draw, the phlebotomist lifts and removes the protective metal seals from the culture bottles and cleans the tops with isopropyl alcohol. Withdraw at least 3 cc of blood from the line and discard as waste in a biohazard container. Using another syringe, the nurse withdraws 8 to 10 cc from the central line. The phlebotomist receives the syringe from the nurse and inoculates the aerobic bottle using the safety transfer device. After the nurse withdraws the second 8 to 10 cc of blood from the central line, the phlebotomist then inoculates the anaerobic bottle. After the specimens have been obtained and the sharp discarded, invert the Bacti-Alert bottles 3 to 5 times. Label the specimen culture bottles and transport the specimens according to facility policy. In summary, a general blood culture request requires 2 sets of separately drawn blood specimens. When using the Bacti-Alert blood culture system, a total draw per site for adults is 20 cc of blood divided between 2 Bacti-Alert bottles. For pediatric patients, 2 to 4 cc is recommended. When the central line draw method must be used for collecting blood, the procedure must be performed by licensed personnel. The steps for collecting blood using the central line draw method are: identify the patient according to facility policy, have all necessary supplies within reach, prepare the site aseptically using a chlorhexidine-based antiseptic, inspect the Bacti-Alert bottles for cracks or contamination. Mark fill volumes. Remove metal seals and clean tops with alcohol. Aspirate 3 cc of blood and discard into biohazard waste container. Aspirate the appropriate amount of blood. Attach the safety transfer device to the syringe. Inoculate the anaerobic bottle, then the aerobic bottle. If vacuum tubes are to be filled, insert the tube adapter insert into the adapter cap and fill tubes in recommended order of draw. Invert Bacti-Alert bottles 3 to 5 times. Label the bottles. Place bottles and tubes into biohazard bag. Transport specimens according to policy.
A properly collected blood specimen that is free from contamination is critical to providing accurate and reliable blood culture results. With the dedicated efforts of medical professionals like you, the blood culture will provide the clinically relevant information needed to improve patient outcomes, reduce length of stay, and prevent the use of unnecessary antibiotics.